All right. Hello, everyone. Welcome back to NHF's Wednesday webinar series. We're going to, as always, give it just a minute before we go ahead and get started. Happy New Year. I hope everyone had a nice holiday season. We're excited to be back again with you. I'll give it just one more moment before we kick off and get started. All right, well, good afternoon, everyone. Thank you for joining us once again for our weekly Wednesday webinar series, our first one of 2023. We are so happy to have you here. Today's webinar is on updates on the VWD guidelines in honor of their second anniversary. My name is Alsa Murtha, and I'm the Manager of Strategic Communications here at the National Hemophilia Foundation. At any point during the webinar, if you would like to ask a question, please use the Q&A feature at the bottom of your screen. If you're joining us from one of our live streaming social media platforms, you can go ahead and pop your questions in the comments. We have NHF staff members monitoring these questions, which we will pose to our speakers after their presentation. This webinar is being recorded and will be available to the community beginning on Friday, January 13th. I am joined today by Kailee Boedeker, Nick McRae, and NHF's Lena Voland. Thank you for taking the time to join us today. I'll go ahead and turn it over to you to get us started, Kailee.
Great. Thank you so much. Thank you all for joining, and thanks for having me. My name is Kailee Boedeker, and I'm a manager of clinical quality improvement at the American Society of Hematology. Today, I'll be sharing some information related to the ASH, ISTH, NHF, WFH 2021 clinical practice guidelines on the diagnosis and management of von Willebrand's disease. I don't have any disclosures to share. And as I mentioned, the two publications that I'm going to be discussing today are available in the open access journal Blood Advances. Before we dive into many of the activities that are happening and resources that are being shared, I want to go back to the beginning of the guideline development story. I think many, if not most on this call, are pretty familiar with VWD, who's affected, and what types of health challenges can manifest as a result. So I'll keep it brief and note that without evidence-based clinical research, these guidelines would not exist. At the very foundation, it's critical to advance research so that patients living with VWD can receive the absolute highest quality of care. Stakeholder engagement is one of the most effective ways to support the call for additional research for conditions like VWD, and I want to thank you all for joining today to hear more about it. In 2015, during a strategic summit focused on VWD, which was hosted by NHF, it was determined that a well-qualified and authoritative organization or a consortium of such organizations should develop a new or updated evidence-based clinical practice guideline on VWD. A scoping survey was conducted to, number one, identify topics of highest importance to stakeholders that could be addressed by the guidelines, and two, to provide those priorities of the community. A total of 601 participants responded to the survey. 49% were patients and caregivers, and 51% were healthcare providers. The highest priority topics were identified, and they were diagnostic criteria and classification, bleeding assessment tools, and treatment options for women and surgical patients. In contrast, screening for anemia and differentiating plasma-derived therapy versus recombinant therapies received lower ratings. And on this chart, in the blue, you can see the patients and caregivers, and in the orange, you can see the providers. So collaboration got underway, and the co-sponsoring societies were identified. Expert methodologists, clinicians, and patient representatives were nominated to serve on the panel. I can't emphasize just how important patient participation was to the entire guideline development process. And I want to thank each of those patient representatives for their contributions. Staff from each of the organizations attended panel meetings, and this allowed for collaboration around dissemination of the guidelines to start very early on. That really helped to contribute to success. International perspectives were incorporated during the development process, and this helped to prioritize key focus areas of the guidelines to ensure that all of the time and effort was put to use in the most effective manner possible. And at the very end of the thorough and thoughtful development process, the guidelines were published. The collaborating organizations have used a three-tiered strategic approach for disseminating the guidelines. First, we've worked to raise awareness of the existence of the guidelines, and we're actively working on dissemination strategies like education and resource development. And finally, we're focusing on implementation, meaning integration at the point of care or through policy change. To raise awareness of the guidelines, the societies worked together on a joint press release, united social media campaigns, and through e-newsletters reaching a variety of audiences, both clinicians and patients and caregivers. Video interviews with the panelists were recorded and made available for easy sharing, and the guidelines were and still are being presented and promoted at annual meetings hosted by the societies, as well as at other relevant societies, such as the Council for Medical Specialty Societies, where these guidelines were most recently shared. Because the primary audiences of each organization are different from each other, the number of projects underway in terms of resource development is significantly higher than if a single organization were creating the resources independently. And this cross-sharing of resources has really reduced duplication and increased the rate of dissemination quite significantly. Some of those activities include infographics and snapshots about the guidelines, translations of the guidelines into different languages, patient summaries, a mobile app where you can access the guidelines at your fingertips very conveniently, educational teaching slide sets, which walk through a clinical scenario, offering the clinician a choice to choose A, B, C, D of different options of how you would proceed with that case, and then refer back to a recommendation to help make sure that they can really have the opportunity for education. The guidelines are also included in the Guideline International Library Repository, which is a really useful resource among the guideline community. The guidelines are disseminated through podcasts and community workshops as well. Additional dissemination activities include virtual summits, commentary, publications in journals, and the CDC has even leveraged the guideline content for their public health webinar series on blood disorders. Pocket guides have been created for clinicians to use at the point of care. These are printed resources, laminated, very nice material so that people can distribute it and share it with fellow colleagues who may be interested in having the recommendations accessible. And continued education at annual meetings is underway in addition to these wonderful webinars. As resources are prioritized, the collaborators have made sure to communicate our plans to develop the most comprehensive resource possible. And as clinician and patient education progresses through those resources that were shared just a moment ago, I want to note that there are even more resources which haven't been included for timing's sake, but those are all available on the individual organizations' websites, which make sure to cross-promote each other's organization websites so that everybody can get access regardless of where they're coming from, clinician or patient or caregiver. So some activities focused on implementing the guidelines at the point of care that are either completed or are in progress include changes to ICD codes, the development of patient decision aids, and clinicians who have taken the guidelines and created quality improvement programs at their institutions and have actually measured change in practice are provided the opportunity to showcase their projects through our Guideline Implementation Champions program. At this stage, future activities for development that haven't been started yet but are relevant and are appropriate include clinical quality measure development, the provision of quality improvement toolkits, and the creation of clinical decision support tools. Before the guidelines had been published, there was only one ICD-10 diagnosis code for VWD and all subtypes. The new guideline indicated that the recommendations varied by type of VWD. And so it was important to make a change and to increase the number of ICD-10 codes. And the proposal for the new codes was submitted and successfully was accepted. And those new codes were published in the Medicare Inpatient PPS Proposed Rule for fiscal year 2023. So that's really an outstanding accomplishment and really speaks to the policy implementation that was successful. Now, as implementation strategies are put into place, the organizations are working to evaluate the impact of the guidelines through metrics related to educational resources, audience engagement, usage, citation data for the publications, and measurement of clinician awareness and adherence to the recommendation. This impact data allows us to work through barriers to dissemination and implementation as the guideline progresses through the life cycle. And to adhere to the the rigorous standards that are set among the clinical practice guideline development community. The collaborating organizations are monitoring the guidelines and will make sure to update recommendations as new evidence emerges. Thank you all for having me online today. It's been a pleasure to share a little bit about where we're at and where we're headed. Please always keep updated with the guidelines, and you'll be sure to learn more about things as they progress. So I'm going to turn it over to Lena next, who's going to share a bit more from the NHF perspective.
Thank you so much, Kailee, for that wonderful and amazing overview. And I'm going to go ahead and share my screen here. So just bear with me for 1 second. Okay, so for everybody who doesn't know me, I'm Lena Voland. I'm the Director of Education at NHF, and I have had the pleasure to really step in and start working on the VWD guideline project as we were focusing a lot on the dissemination. So it is the anniversary of the VWD guidelines that were published 2 years ago, which, gosh, I can't believe that it has been already 2 years. But as you have just heard from Kailee, we all have been very busy at our respective organizations and then really collaborating with the different organizations to disseminate the information of the VWD guidelines. And with this, not only educate people about them and raise the awareness that these are in existence, but taking very active steps to implementing the guidelines into the clinical setting. Obviously, it is not done by just putting wonderful and amazing guidelines out there with the hope that these will get implemented. There are many, many different steps that we can take to support our clinicians so that they can utilize the guidelines in their day-to-day work in the clinical setting. So you've heard a couple of those wonderful activities and initiatives from Kailee, and I wanted to take this moment to highlight a couple more of, or do a little bit of a deeper dive on what we have been focusing on at NHF, especially from the educational lens. So as you all know, many of you have seen this slide over and over again on our mission, but I really want to always highlight that last little component here, which is enabling people and families to thrive. This is really why we all came together. This is really also at the heart of the development of the guidelines and the collaboration of these organizations. It is ultimately about the people that we serve, about our VWD community, and enabling those people and their families to thrive. This is what the guidelines are really supporting as well. So keeping this in mind, I have nothing really to disclose besides obviously my role at NHF, but there are no other disclosures that would be relevant for this presentation. Kailee has mentioned this earlier, so we really started out with the education front to really let people know what these guidelines are. So once they were published, we started a Wednesday webinar series. So the same Wednesday webinar that you are attending here today, we have had these in effect for quite a while. So we provided Wednesday webinars at the beginning once they were published. And we started out with the first one to really highlight how these guidelines came about, how these were developed. And you've heard before many times that we really included the patient voice. So it was a wonderful bottom-up approach where the patient voice was included right from the beginning, and where they became voting members and really had the opportunity to contribute to the development of the guidelines. So first Wednesday webinar was really focused on how were these developed. And then we really dove deep into the specific recommendations. We devoted one Wednesday webinar to our diagnosis, as well as another one to the management. And then we finished off with shared decision-making, and really how could a community member utilize the guideline to really support them to advocate for their care and to really gain the access that they needed. I put some numbers in there on how many people attended those. Those were our live attendance. But the wonderful part is that these Wednesday webinars, they are still available. So you can actually go onto our website and you can still view these wonderful Wednesday webinars if you're interested to do so. So they are right there. Another component that we did was a social media campaign, and this was then pretty much brought out between all the different organizations. And we utilized all of our different platforms. So it was on Twitter, on Facebook, on LinkedIn, and on Instagram. And what we did, we highlighted some specific recommendations. And we also brought in some of the experiences from our community members and how these guidelines and these specific recommendations will really help and support their day-to-day lives. So those were really highlighted first during the anniversary month of the VWD guidelines. So once the VWD guidelines turned essentially 1 year old. And then throughout this year, we have always sprinkled them a little bit back into our social media to just remember everybody about the guidelines and that those are there. So some of the evaluations data that we have been following, this is from when we really started our social media campaign initially. So we've really reached a large amount of people here with different impressions, interactions, shares, and we really hope that more people will benefit from this knowledge. So you might still see some of those being put out there as well. So then obviously we highlighted our VWD guidelines during our Bleeding Disorders conference. As the guidelines were in development, we had some sessions on there to really let people know what was in the works. But once they were published, we really wanted to bring out the word on the VWD guidelines a little bit more. So back in 2021, we actually had devoted the entire VWD pre-conference to the VWD guidelines, and we unpacked some of the recommendations, but we also dove deep into the process of how they can work for our community and how patients can utilize them. So we had a really great attendance to those, and the majority of people really truly found this session extremely meaningful, learned something new, and were ready to go out there and implement that. Now, this year, we focused again on shared decision-making. And again, we unpacked some of the recommendations and really dove deep into the points of shared decision-making, where the patient voice and their values and beliefs needs to be integrated to make a decision on a plan of care, which is really truly outlined in the VWD guidelines as well, and with some great attendance. And as you can see with this wonderful evaluation data, everybody took something valuable and meaningful away from this session. It was meaningful. People learned new skills and ideas, and they were ready to implement these skills and ideas. We will carry this forward into this next year. So information regarding the VWD guidelines and how they can be used will always be sprinkled in a little bit, but this is what we have really brought forward in the last 2 years and have integrated them. Now you've seen, Kailee mentioned these before too, and this is such a wonderful resource that is now available to our community. So we have obviously the guidelines that are freely accessible, but the guidelines themselves, that's a long document. And so we really wanted to break down the specific recommendations and also put them into terms that everybody can fully understand them. So we have created these 2 great summaries, and one is focused on the diagnosis and the other one is focused on the management. And it breaks down each and every one of the recommendations and outlines exactly what it says. And these are freely available. You can actually access them on our website and download them to have them available, or you can also order them through our organization, and we'll be happy to provide them to you. It really breaks down all of the different recommendations and is an easy tool to have. Another component that we developed was Education for Empowerment workshop. So Education for Empowerment is our big program that we have within the education department, where we provide workshops to our chapters. So our chapters can actually request different workshops, and we will provide them at their events. So back in 2021, we designed a new workshop on the VWD guidelines and launched that in that year. And it was very much beloved by the community, as you can see with the evaluation data there. And this workshop actually was one of the most requested ones in 2022 and found some great appreciation in our community. Now, this particular workshop, again, breaks down a little bit how the guidelines were developed, dives a little bit deeper into the specific recommendations, and then outlines how our community members can utilize the guidelines to advocate for their care as well. So these particular workshops are community facing. And then this workshop will also be part of our Education for Empowerment program this year. So again, chapters can request this workshop, and we will be happy to come out to the events and provide some more information about the VWD guidelines. So as you have maybe seen before, we have a VWD toolkit. So with the publication of the VWD guidelines, we needed to update that toolkit a little bit and integrate some more information on the guidelines and make sure that everything is in alignment as well. So we have actually redesigned our toolkits a little bit to not only integrate that information, but also combine it with a lot of other great publications that we do have available. So we've created 2 different versions there, and both versions are available to our community, so you can request them. It has wonderful information, not only about the VWD guidelines, but really what VWD is, what the current treatments are, how you can live with VWD, and then it also includes some tools that you can utilize in your day-to-day life. So those 2 toolkits are available now. You can request them through our website, through Handy, and we'll be happy to provide them to the chapters, to our HTCs, to our providers, and whomever would be able to utilize them. So obviously those were some wonderful efforts that all 4 organizations have put into motion in these last 2 years, but we're not done there. So we are continuing to work on many different initiatives. And one that I really wanted to highlight here is the development of shared decision-making tools. Kailee has mentioned this before too, so I just wanted to dive a little bit deeper of where we are in this process and where we are planning on going. So again, we want to continue the rigor of the VWD guidelines and how they were developed, and we want to really continue that forth into the development of any other resources that we are designing for clinical use and for our community. So as we are moving forward with the shared decision-making tools, this will be developed in 2 different phases. So we have hosted multiple focus groups with different stakeholders. So that includes people from our community, people who are living with VWD, different types of VWD, parents and caregivers of people with VWD, as well as chapter representatives, and then all of our different healthcare providers. So we had OBGYNs join us, hematologists, physical therapists, social workers, nursing. So all the different groups were represented in our different focus groups. So there we really wanted to hone in on what recommendations to focus on for the development of the shared decision-making tools and what people would want to see them, what information needs to be included, and what these shared decision-making tools should really look like so that they can be used effectively in the clinical setting. So from there, we're developing the prototypes, and this is exactly what we are focusing on right now, is to develop the first prototypes for the recommendations that we will be focusing on. And then in the next step, we will bring this back to our focus groups. So this is our alpha testing, so they can really review our shared decision-making tools, make any other additional recommendations. And then we will test these in the clinical settings. So we have recruited numerous sites throughout the country, and we'll actually try these out in the clinical setting, before we can finalize the product. So right now, again, we're really focusing on developing the first prototypes for our shared decision-making tools, and we are very much looking forward, and we're extremely excited to present you within the year with hopefully our finalized product. So this is one of the big efforts that we are moving on forward with. So one last thing that I really wanted to mention is that all of these initiatives would not be possible without the collaboration of the 4 different organizations. It was really a combined effort to not only develop the VWD guidelines, but really to continue our collaboration forward into the dissemination. And as Kailee has mentioned before, it really helped us to limit any duplications and rather putting our efforts, our resources, and our ideas together to really support each other, to make sure that we are bringing the word of the VWD guidelines out there and support the implementation process in the clinical setting. So with this, I wanted to thank everyone for your time, and I'm going to hand it over to Nick, who's going to talk a little bit more on his perspective and how the VWD guidelines have helped him.
Hi, thank you, Lena. I'm Nick McRae. I am a patient with von Willebrand's disorder. I have type 2A, and I'm really thankful for these guidelines. They've helped me tremendously. After these came out, I was working with my medical team on prophylaxis, and having read the guidelines, it was a little bit easier to have that conversation, knowing that I could use my hospitalizations, but also talk about quality of life. And kind of point back to what some of the guidelines said. And my team and I agreed. We came to a consensus that Prophy was the correct fit. And we kind of worked out what the best plan would be. And then we submitted for insurance approval. And insurance said no, because they didn't see much in the documentation they had about Prophy for clients with VWD, they said. So my team thankfully got onto a peer-to-peer and sent them the newly released treatment guidelines, and they showed all the things that point to Prophy use in people who have von Willebrand's disorder, and when it can be useful and why it's used, and they highlighted those. And the insurance company said, "Oh, that's awesome. We hadn't seen this before," and approved it. And so thankfully, I've had to switch insurances since, and my team knows to always send that documentation along to kind of show the clinical supporting information about why we've chosen to go on Prophy, and that it is backed by science and by all these different organizations who've come up with these treatment guidelines. So for me, it's really enabled me to access the treatment that I need at the level that I need. And I think without having those guidelines readily available, I think it would have been a lot harder for me to access Prophy the way that I have. So I'm super thankful.
Thank you so much, Nick, for sharing that experience with us, which I think really highlights again how important these guidelines are, but also how we can utilize them not only in a clinical setting from a healthcare provider perspective, but how they can help you as a patient as well. So let me ask you a question very quick, if you don't mind. So were you stunned in that moment when your insurance essentially came back and said, like, no, you can't have prophylaxis because we don't see that written anywhere and it's not indicated for your care?
I was a little bit. I always expect some kind of hiccups to happen with insurance, but the fact that they hadn't seen it written anywhere, I was feeling defeated. But thankfully, my nurse and nurse practitioner, my whole team, brought up that I had brought in these recommendations from WFH, and they had seen them because they'd been recently published and were kind of everywhere, thankfully. So it was only a short time that I had to go through this, but it was a little shocking for me.
Mm-hmm. And did it go pretty smoothly once you were able to provide the guidelines to the insurance?
Yeah, like I said, they saw it. They hadn't seen it before, they said, and they made a decision pretty quickly to approve it based on that. And I haven't had a hiccup with insurance since, because I know they always send the highlighted portions of that with my PAs every year. So
thank you so much. So thank God for these guidelines. And thank you so much, Nick, for sharing that information with us. So yeah, are there any questions from our audience here in regards to the VWD guidelines or the efforts that are being put forward by ASH, ISTH, WFH, or NHF, or maybe to Nick and his perspective?
Yeah, we have a couple so far, but if anybody else has any additional questions, you can just throw them in the Q&A or comment them on whatever platform you're streaming on. Our first question is, how do you suggest we discuss these guidelines with our providers? And I think that's a good question kind of for everybody to chime in on with your different perspectives.
Yeah, I can maybe start here and then hand it over to Nick and Kailee too for their perspectives. I think it depends a little bit if we're talking about a healthcare provider who works at an HTC in comparison to a healthcare provider in the community setting. So I'll address both little bit. So hopefully most of our healthcare providers who are working in the HTC setting have heard about these guidelines. As you've heard from Nick, they were all out there and there were many initiatives brought forward. So I'm hoping that they have at least heard about them. However, I think it is always helpful to bring them forward, especially when you have specific questions about specific recommendations or really want to have a deeper dive conversations about them. I always like to have some materials with me. I always like to have like something short that I can refer back to and that I can also remember what I really wanted to say. I'm often sitting in a physician's office and I might forget something that I wanted to address. So I would, for example, recommend that you print out or have it on your phone the summaries of the recommendations and maybe mark down a specific recommendation you would like to discuss with your healthcare provider. Then you can show them and you have something on your hand for that discussion purpose. You can do a similar approach also for a community provider. However, there might be the situation that they might not have heard about the VWD guidelines to begin with. So I think it's always good to provide resources to them as well. So you can actually bring a printed copy of the publication of the guidelines. Those are freely available in Blood Advances. So you can actually just follow the links that we have on our website and you can print out the full recommendation, or you can provide that link to your healthcare provider and they can read all the details of how these recommendations came about, why it was voted in one way versus another, and what the underlying evidence for each of those recommendations is as well. You can also bring in the summary sheets to really highlight specific recommendations you would like to discuss, but at least you can bring some additional resources and information to them as well. And then you can also, if you wanted to give more information, you can link them back to some of the other great resources, especially for the healthcare providers out there. ASH has those available on their website. There are a couple of great short videos, there are teaching slides, they're all freely available. So, and we are happy to connect you with those websites and those resources as well, so you can easily have them at your disposal. So, but Nick or Kailee, one of you, do you have any other suggestions?
I just wanted to add on to what Lena was mentioning at the end. The methodology for developing the guidelines includes a very rigorous process of evaluating each clinical trial, synthesizing the evidence, and putting all of that, the clinical judgment into evidence to decision frameworks. So within the guidelines, you'll find links to the evidence to decision frameworks for each recommendation, where you can open it up and see why the clinicians who were on the panel made the decisions that they did to recommend in either direction. They also assessed and evaluated the strength of the evidence, whether it was low, moderate, or high, and they evaluated their certainty of the recommendation based on that evidence. So being able to drill down another layer further, although the guidelines are very lengthy documents, if you're looking at one specific recommendation, bringing that evidence to decision framework to your clinician who may be able to discuss with you, or you can look at it yourself and kind of make your own informed decisions based on what you're seeing in the evidence. As I mentioned in the beginning, there's not evidence available for everything. And so part of that can be a call for additional research. And that's a really important part of the guideline process.
And I'll just say, as Lena had said, I think, I personally chose the parts that I thought were relevant to me and brought those up with my providers. And having that document there was really helpful. So that's how I approached it from the patient perspective. I know there's other, parts that you can pull out based on your own situation. And thankfully, as I think they've both said, there's some really basic patient-facing ones that are really easy for us to understand and kind of written in a way that makes a lot of sense as someone who's a patient. But then there's also parts where the providers can go on and get something a little more clinical, a little more that might have language that's a little easier for them to get that might not make as much sense for us. So I think kind of the variety out there makes it easy for you to kind of bring your piece. And then there's places they can, you can kind of send them to find parts that might give them more of the clinical piece that they're looking for, which is cool.
Fantastic. Thank you, guys. Can you tell me once more where we can find the guidelines?
The full guidelines, the complete written documents, or so the publications or the summaries of the guidelines?
I would say both.
Okay, so if you give me 1 second and maybe Kailee can highlight that too, I can actually pop the links in the chat if that would be helpful. But just to mention it again, the publications, they are freely accessible. They were published in Blood Advances. So in that particular journal, you will find them, but I will post the links. And then you can also find that information on our website. So the summaries of the recommendations, you can find them in our publications section, as well as the VWD section. And you can also find links to the full recommendations on that website as well. But if you give me just a second, I had them in the slides, but I will put them in the chat so everybody can see them too.
Thank you, Lena. Okay, I'll move on to our next question. In the meantime, when the guidelines were being created, what was something that everyone was surprised to learn while working on them? Was there anything that was really shocking or really beneficial that they found while working on the guidelines?
I would be happy to try to answer this question based on a story that I heard from Nicole Scappi, who's a NHF employee and education specialist who presented alongside me at the Council for Medical Specialty Societies, where we presented the guidelines. She shared with me that during her development, or during the guideline development process, there was sort of a patient perspective onboarding process where she was provided some kind of background about what's going to happen, what to expect, where her input is going to be most valuable, and so that she wouldn't feel overwhelmed in the situation, and that she would feel she had the tools she needed to participate. And I remember her sharing her story about being on the panel, and she told us about a moment where there was a question going around in the room as they were working through conversations about bleeding assessment tools, and she recalled asking kind of point blank, why wouldn't we do it this way? And it was about the bleeding assessment tools, and it sort of stumped all of the clinicians in the room, and they were like, well, that's actually a really good point, Nicole. That's exactly the right way to think about it. And so I think that her perspective in that very moment was something that really shifted the direction of that recommendation about bleeding assessment tools, and it was really valuable and instrumental to really have that at that exact time. Unfortunately, she's not on here, I don't think, to tell us about the story herself. I just wanted to kind of share that she did share that with us at the meeting, and it really stuck with me that I'm very thankful that the patient panelists who were participating were there, because they shifted the entire direction of guideline recommendations with what they had to contribute.
Awesome. Lena, do you have anything else to add to that, or Nick?
I can add another great story that came from one of the other panelists, who's one of the healthcare providers, said that very initially, before they really sent out the survey to kind of pick out the topics that the panel should focus on, that they all had set their heart on many different topics, and there were many more topics than they could really tackle with the panel. And they were very surprised how some of the topics they felt very strong about were not necessarily at the same level than others, and some had to shift and some had to not be addressed. So that initial survey that Kailee highlighted too, was very instrumental and insightful. So that is another story that I remember from it.
Great, thank you guys. Do you plan to continue to develop the guidelines in the future, or are there any plans to continue to develop the guidelines?
I'd be happy to try to answer this one first. So as guidelines mature through their life cycle, they are required to go through monitoring and updating processes. And that just kind of ensures that the recommendations are still valid, new evidence hasn't come out or emerged that would change something. So the way that we address this is by having a librarian do an environmental scan and a literature search and sort of see what's out there. And that preliminary scan is what informs the decision whether or not the guidelines need to be evaluated further to decide whether they need to be monitored or updated or retired. Something could happen where new evidence emerges that completely changes the course of treatment. And so the guideline recommendations are rendered inapplicable at that point. So once the guideline goes through the initial library scan, literature review, a small group of clinical experts will take a look and sort of determine whether or not more evidence is available that will inform the recommendations. And then the guidelines will go through a more formal process of convening a panel. A call for nominations is posted, and patient representatives, clinicians, methodologists are all invited to either self-nominate or nominate a peer where they can participate in the guideline panel. Once the panel has been formed and selected and all of the necessary expertise are around the table, the guideline methodology group will do a more thorough and in-depth literature review and analysis to present that evidence to the guideline panel where they can make recommendations and sort of go through that evidence to decision framework once again from square one and be able to publish new recommendations. Once the chairs or the clinical experts who are making the decision whether or not to monitor or update have made their decision, a commentary will be published that will kind of guide the community and let them know, hey, this is something that's going to be coming. It's going to be an update to the guidelines. So we really have a advanced notice and a head start on being able to understand and look at the evidence and see where the changes are going to happen. And so that commentary really is the kind of the green flag for, okay, something big is going to happen, a new change will be made. So, and those commentaries are going to be made available. And so those will also be disseminated. And so everyone should have plenty of advance notice that, that a guideline will be updated. And so, yeah, the kind of 2-year mark of the guidelines life is when we start to look at that evidence and get things going in that sense. So we will keep you all updated. You'll be the first to know when any new evidence is indicating that we should update.
That's great. Thank you so much. I don't have any further questions. So if you'd like to say anything else before we go ahead and sign off, if anybody has anything else they'd like to include, Lena?
Sure. So we just posted the links again in the chat for everybody who would like to see. So these include the links to the actual publications that are freely available, as well as the snapshots and the summary recommendations that are there. But in all honesty, if you are looking for something in particular, if you are looking for a specific resource, if you're looking for something on the patient end, please feel free to contact us. We're more than happy to provide you with these. They are freely available to you. So we'll be happy to print them, send them to you, or send you the electronic version. We're also happy to connect you to any of the other resources that are available. For example, the pocket guides that Kailee mentioned. Those are really great guides for our clinicians to have handy in the clinic, or if you want to find the app, so you can have the guidelines directly on your phone and you can quickly look them up. So we're happy to connect you with any resource that you are looking for. There are plenty of resources out there for all of our different audiences. So there's, again, information out there for people who are living with VWD, for their families, caregivers, friends, but there's also a multitude of really wonderful resources available for our healthcare providers. And we are more than happy to connect you with those that are needed and help you to implement these in the clinical setting to the best of our abilities. And then with this, also stay tuned. As you've heard, it's not just done with developing guidelines. There are many more processes that will follow to really help the implementation, and then to also keep them updated and keep them aligned with the current evidence that is out there. So please stay tuned for more. All of our organizations are continuing to collaborate on the VWD guideline dissemination as well as the updates. So there's much more to come in the future.
Great, thank you. Well, I'd like to thank the three of you again for joining us this afternoon, for taking the time out of your day to come and present. We appreciate your time and expertise. I'd also like to thank each one of our viewers for joining us again right in the new year for the Wednesday webinars. We're so happy to be back. Please note that this recorded webinar will be available on Friday, January 13th at hemophilia.org under the events tab with all of our archived webinars. Also available in the events tab is our upcoming schedule for our weekly Wednesday webinar series. Thank you again for joining us this afternoon. Have a wonderful week, and we will see you next Wednesday. Bye, everyone.